Today's book review is on Wilderness Medicine Beyond First Aid. This is the 5th edition by William W. Forgey, M.D. The book was published in 2000 by the Globe Puget Press. William Forgey, the author of Wilderness First Aid, is a medical doctor and former president of the Wilderness Medical Society. This organization is responsible for the guidelines that make up what injuries and medical issues should be considered wilderness or backcountry first aid. Wilderness medicine is considered medical reference in remote areas when immediate care or access to a medical facility is difficult or impossible. It also informs the reader how to recognize, assess, and treat many kinds of medical emergencies in the wilderness. Any medical emergency in a remote area presents a multitude of challenges that are not normally faced in an urban environment with easy access to urgent care facilities and hospitals. If you are operating in a remote area where professional medical services are hours or even days away, you may benefit from the information in this book. In the beginning of the book, there is a preface in which the author describes the differences between some earlier versions of the book and this 5th edition. He also describes some information and website links to where updates and color photographs with cross-referencing information can be obtained. There is also an appendices with A and B. Appendix A is the Wilderness Expedition Medical Kit, which is a list of medicines and supplies that should be carried on expedition-type operations. This also includes quantities, dosages, and descriptions of use. Appendix B is the International Immunization and Dosage Schedule for Travel. The very back of the book contains a detailed index. The author not only gives the reader the types of formal medical equipment that could be used for the treatment of injuries, but also gives examples of what types of backpacking or household equipment could be used as a substitute for formal medical gear. This allows the reader to think outside the box by using unconventional tools and materials for first aid. The author points out the importance of an initial survey of the scene. This is important because a lot of first aid guides skip over this and proceed right to the topics of injuries. Since accidents tend to multiply, it's important for the medical care giver to check the scene of the accident for safety before approaching the victim. The author includes several tables and charts that help summarize the discussion of a particular topic, along with including dosage schedules and substitutes of different over-the-counter medications and prescription drugs. There really aren't enough illustrated examples of medical procedures in the book. For example, there's a somewhat lengthy description of a ruptured eardrum procedure. There's a lot of comprehensive textual description of that, but no photos. Also, the author doesn't address what a ruptured eardrum would even look like compared to one that isn't. Some of the illustrations that are in the book, such as in the suturing section, are very primitive and not detailed enough to show an accurate representation of the medical procedures being described. Even though a lot of the topics in the book do go beyond first aid, a lot of them don't, nor do they add any great depth to the discussion. For example, the paragraph on managing diabetes doesn't offer much in terms of a solution to treating it in the wild, other than to say that insulin should be kept out of sunlight. For example, if a patient is suffering from low blood sugar, the book only advises give the patient some candy. It doesn't advise candy is good because of the sugar content, how much candy to give, what signs or symptoms will show that the patient is feeling better, etc. So the book leaves out some important information that wouldn't take up much extra real estate to cover. The book is also a bit dated, being 10 years old, and there's a lot of information out there that is more recent. For example, One of the outdated materials inside the book is a discussion about anaphylactic shock and the use of epinephrine. In the book, it discusses a few options for purchasing EpiPens and their uses. But a lot of that data has been updated in the last decade. In the preface section of the book, the author boasts about having a website that would provide updates and additional resources for the reader. However, that link is broken and there is no further information available. The Wilderness Medicine Society defines what injuries are considered those related to wilderness medicine. In that case, the content of the book is robust and the subject base is considered adequate for what is defined as wilderness medicine. Although some of the topics are not as in-depth as may be desired by some readers, it does provide information to the reader beyond first aid and covers a lot of ground on topics that would otherwise be left out of a typical first aid guide. The author also describes for the reader the importance of not just reading about wilderness medicine, but getting out and actually doing it. Take some classes, get some training, and then prepare yourself mentally and physically and practice the techniques that you learn. The Field Guide to Wilderness Medicine, published in 2008 by Eric Weiss and Paul Auerbach. Mountain Rescue Doctor, Wilderness Medicine in the Extremes of Nature, published in 2008 by Christopher Van Tilburg. Wilderness Medicine is widely available online at many online retailers as well as bookstores. Its cost varies between $10 to $15. Wilderness Medicine Beyond First Aid received 3 solid stars. This book was mostly predictable. Although enjoyable, it adds little to the available content already in publication, due in part to the fact that it's nearly a decade old since publication. Arguments are for the most part solid, yet are lacking in some areas. Wilderness medicine is considered to be of average value, but excels in some areas. Check it out for yourself. Thanks for watching the Survival Bookshelf, and stay tuned for more.